Hello, my name is Ariel Carter. This is my patient TR, and today we're going to be doing a head and neck assessment on him. Hello, TR, how are you?
I'm good at yourself.
I'm good. So today we're going to be doing a head and neck assessment on you. And before we actually do our assessment, what I'm going to do is ask you a series of questions regarding your head and neck, any previous histories of anything, okay?
Okay.
All right, so first question. Have you had any unusual or any severe headaches?
No.
Any head injuries that you can think of?
No.
All right. Have you experienced any dizziness, any episodes of syncope in the past?
No.
Any neck pain?
Other than working out, no.
So can you explain that to me?
I mean, just typical soreness from working out.
And is this usually ongoing, or is it usually when you begin to work out, and or is it when you're consistent when you work out? Is it a sudden onset?
It's consistently after, maybe a day after 24 hours after I work out.
Okay, and
But
so
it's normal. To me, it's normal.
okay, and so how long does this pain last?
Maybe a couple days.
Okay, so it's just usually just soreness
Mm.
from the weightlifting. Alrighty, any lumps or any swelling in the neck that you've noticed?
No.
Okay, history of any head and neck surgery in the past?
No.
Alright, and what do you do as far as your career?
A respiratory therapist.
Alright, so do you experience anything that will cause any traumatic injuries or any pain in your head or your neck on the job?
No.
Okay, awesome. So now that we've gone through these questions, I'm actually going to do an assessment on you. What I need you to do is sit up, please. Erect. Put your head midline. All right. So first, what we're going to do is I'm going to inspect his head. And what I'm looking at is just pretty much the generalized size and the contour of the head. And what it is that head should be almost approximate and proportionate to the size of the body. So he has a normal cephalic head. There is no lumps or there is no lesions or no swelling that I feel as I'm palpating. None of that. And when they have a lot of hair like this, what you need to do is just go inside the head to make sure that you don't feel any lumps or any swelling on the scalp. Okay. There is no deformities, as I've stated. Now we go down to his temporal arteries. Temporal arteries are located right here on the side of the head, right above the ears. And you can actually palpate the temporal arteries. You'll feel a soft pulsation on both sides of his head, as I do. And then his temporal mandible joint is here. You can turn straight for me. It's here. And what I need you to do, I need you to open your mouth and close it. Keep doing that for me. And I can actually feel it moving up and down as he opens and closes his mouth. And there's no limitation. Do you feel any tenderness when you do that?
Yeah.
So it's freely movable and there is no tenderness there. So that joint is good. So now I'm going to assess your face. Your face should be symmetric with your eyebrows, your nasal labia folds here, and then also your mouth creases. Everything seems in line. There's no drooping. There's no asymmetry in his face. Anytime you see any drooping or anything like that, those are signs of sometimes residual from CBA or anything of that nature, but his face is all symmetrical. There's no voluntary movements either. As I'm looking, he doesn't have any voluntary movement. Sometimes when you see that, it can be sometimes tics or other disease processes, but there's no voluntary movements noted here. There is no edema. His face is actually soft, smooth, no swelling, no edema present, no masses or lesions anywhere. as I've stated, the color and texture. He has normal color in his skin. The texture is smooth and nice. He also has a lot of facial hair, beard and mustache. And then also under here, sometimes with the hair, just for sanitary reasons, you also want to inspect up in here too, because sometimes there can be bumps or lesions underneath the hair. So you also want to make sure that this is also inspected. How do you take care of your facial hair? Do you wash it? Do you brush it?
I wash it. Usually my facial wash and moisturizer still goes around it on it.
Okay, nice. And that's good ways to keep your hygiene, to make sure you always wash this, because with your hair and by being so much, there's always things that can get trapped inside or can actually cause some type of infection, especially if you line your hair and then your skin is open. So it's always good to keep good hygiene around your facial hair area. Really good. Okay, so now we're going to move down to your neck area. So what I'm going to do is actually just want to put your hair up a little bit so that we can see your entire neck. And what I'm going to have you to do is actually turn around toward with the chair. Exactly. Okay, so now we're going to inspect your neck. Can you sit up straight and erect for me? Head up like this. Nice. Okay, so the neck should be midline with the body, and it should be symmetric, which it is. And then there should be range of motion in the neck. So what I'm going to do is I'm going to have you touch your chin to your chest. Do you feel any tenderness? Do you feel any aches or pains when you do that?
No.
Okay, awesome. When you put your head back into midline position. All right, now I'm going to have you turn your neck to the right side. Just exactly. Do you feel any tenderness or any pain there?
No.
Okay, we're going to do the same thing. Turn to the left. Any tenderness or any pain there?
No.
Okay, awesome. Now I'm going to have you actually turn your head along with your, like, upward and then to the right. Any pain there?
No.
Okay, we're going to do the same thing here. No pain?
No.
Okay, awesome. Now I'm going to have you tilt your head backwards just a little bit, not too much. You don't want to hyperextend. Any pain or any tenderness there?
No.
Okay, awesome. Now I want you to put your head back into midline position. Awesome. Now, what I'm going to do is I'm going to find your carotid. I'm going to do one at a time. And I'm just going to palpate. You can also auscultate the carotids as well with the smaller end of your stethoscope to listen to them. Pulse there. Nice strong pulse there. So he has nice strong pulses on both sides. Now we're going to actually palpate for the thyroid. Now usually in a normal healthy individual, you wouldn't be able to palpate the thyroid, only if it's enlarged, and that means they may have some thyroid issues. But what we can do is we're going to actually just go to the midline, to the middle of the neck, and then we're going to go to the sternal notch here. And what I'm going to do is I'm actually just going to pull my hands over like this and take these hands to try to feel for the muscle here. And then I'm going to do the same thing on the other side. So I'm actually just in the middle of his neck. If you want to turn around so we can both turn your whole body. Right here in the middle of the neck, the sternal notch. I'm going to hold this, bring this over, and then just go to the sides here. Can you swallow for me? Awesome. And as he swallows, the salivary glands move up, and you can feel the meds there. Okay, I'm going to do the same thing on this side. Move over. Can you swallow for me? Nice. All right. So no enlargement or anything else there in on the thyroid area. So now we're going to move to his lymphs, his lymph nodes. Lymph nodes actually is mostly in the neck area, And if they are enlarged, sometimes that can be a sign of infection because they're actually trying to drain the infection from your body. So what we're going to do is we're going to start here at the periocular lymph, and it's going to be right here by the ear. Lymph nodes should be free, discrete, soft, non-tender, freely movable. And then we're going to go to the posterior ocular, which is going to be behind the ear here. And then we're going to go down to the occipital, which is here. Then we're going to go up towards the front to the submental. Then you're going to go up along the lining of the chin to the submandibular. Then we're going to go up in here to the jugular-gastric lymph node. Then we're going to go down to the posterior superficial here. And then we're going to go to the deep cervical. It's a change. It's 3 of them. They go like this. And it's here. And then we're going to go all the way down to the supraclavicular one. And this one, what I'm going to have him do is hunch your shoulders up and you feel deep down inside. Okay, you can relax now. And that is the pathway of what you should assess for your lymphs. All right, you can turn around. And like I said, they should be free, non-tender, freely movable. Okay. And that's it. That is my head and neck assessment. Thank you so much, and I shall see you soon.